So this is a patient with healthy teeth and gums. When we look at an x-ray, the bone level should be right where the enamel stops on the x-ray. The black triangle should be shaped like a little perfect triangle. If it starts to get long and skinny like this, that means the bone level has dropped and there becomes some areas that's very tough to clean. Periodontitis is when that bacteria film builds up around the neck of the teeth and the bacteria turn into calculus or tartar and start to dissolve the bone and the gums around the teeth. When we do your periodontal exam, we measure around the neck of the tooth. Numbers like 1 and 2 are normal and mean that there's not a pocket forming around the tooth. When it dips deeper down inside and you hear numbers like 4, 5, and 6, that's bone dissolving, and that's an area where this biofilm lives. Biofilm lives on the root. The bacteria multiply and spread into the gum tissue nearby. They know how to live within the tissue and infect the tissue. They become part of it. They move in there, permanent residents. Then they release more bacteria into the bloodstream. Once the bacteria is in the bloodstream, it can wreak havoc in the whole body. Once in the rest of the body, it can cause angina pectoris, heart attack, atherosclerosis, and strokes. It can infect many of the tissues in the body and can be one of the biggest causes of problems in all of us.
Also, all those nooks and crannies in the new pockets are so hard to clean, it can make our breath really, really bad.
You know, gingivitis is the #1 cause of all tooth decay.
Recent studies learns that it has something to do with how we clean our teeth. It's much more relevant on our bite. If the teeth are hitting in the center of each other, the teeth don't rock within the socket, and this little gap stays tight around the tooth where it should.
The uneven bite also causes abfractions, which are notches in the gum line around the tooth. This makes the tooth really, really rough, and stuff is more likely to collect there as well.
If we have a bad bite, it rocks the tooth within the socket, and it leads to these little gaps that form around the tooth. Those are big enough for bacteria to get down. So if bacteria gets in there and forms the biofilm, no amount of flossing gets that deep. So we can try to floss and brush and Sonicare and water pick, and it only helps. But once the biofilm forms, it never really comes off. These aggressive bacteria not only form a biofilm, but they actually can get into the porous structure of a tooth. A tooth is made out of microtubules, and so they have these tiny little pathways through there, and the bacteria get in there. And so traditional scraping that you have done at the regular dental office doesn't get rid of all the bacteria. Sure, it slows it down, but it's not sterile. They're still in there, and they proliferate from there. They're also in the gum tissue, living in there. So this diseased, purpley swollen gum tissue is still there, infected too. So basically we're just hoping to slow down the bone loss, but we've got an infected tooth root surface and infected gums that are still there. So clean it and floss it all you want, we're only slowing it down. That's what most offices do with the scaling and root planing procedure.
No, it's not true. That's impossible!
Search your feelings, you know it to be true.
No! No!
But there is hope. We have some options when it comes to treating it. Our first option is to just brush it at home. Our next option is to get a regular dental cleaning like our insurance covers. While this makes our teeth feel smooth, this does nothing to treat the infection which is underneath the gum line. Much more is needed to remove the biofilm under there.
Secretly, underneath, the toxins are still there, wreaking havoc on the bone level and the organs of our body. Scaling and root planing removes most of the biofilm on the surface of the tooth. It does a good job at that, and most dentists around here do a good job of that with their hygienists. What it doesn't do is remove the bacteria that are living in the tubules. It slows it down greatly, but at most we're just hoping to prevent further bone loss. That's what traditional therapy is aimed at. We here at Smiles by Design have a new therapy where we can actually get some bone to come back. Again, I can't stress how important the bite is on the health of your gums and periodontal disease. If the tooth is continually rocking in the socket, we can clean the surface of the root all we want. By the next day, the biofilm is going to form again. We need to look at the bite and sterilizing the root to take care of this permanently. So if the tooth is rocking in the socket and we sterilize the root, the bacteria are going to get in there by the next day, form the biofilm, and it's going to start over. The goal is to not have to see us here at Smiles by Design every day. These tiny little gaps that form around a tooth that's hitting unevenly in the bite can lead towards increased rates of bone loss. It can lead towards bacteria getting into the bloodstream more. Restorations that are rough, an old crown that's got a rough margin or a dark margin, or a metal filling that's opened up, or a plastic filling that has an overhang. These all create ledges and areas for bacteria to grow. One of the ways we can look to see if your bite is part of this is with the TEC scan. We can have you bite on this computer wafer and it will tell us how hard you're hitting and where you're hitting on each tooth. Ideally, we're in the 50-50 range, 50% on one side, 50% on the other, and you're hitting in the center of each tooth. You don't want to be hitting on the outside edge. Unfortunately, as plastic fillings wear down in the middle of the tooth, we start hitting on the outside edge of the teeth, and that leads towards the tooth rocking in the socket and periodontal disease. These of scaling and root planing don't take care of the bite issue. The bite issue, in most cases, is what led this to happen to begin with. So wouldn't it be a shame to go through all these appointments of cleaning up the gums and then not take care of what caused it in the first place and have it come back a few months later? So I keep talking about the way that we can reverse this. So we've got our regular Prophy, which just cleans the top of the tooth, and we have our scaling and root planing, the one that most dentists do and insurance covers okay. That's the cleaning, the deep cleaning that you've heard of beneath the gums. So that's kind of scraping with the ultrasonic and cleans out most of the chunks. We're talking about laser therapy, laser bone regeneration of the gums. If we shine the laser on the inside of the socket, it removes that infected layer. The laser is super high energy, and any gum tissue that's darker and infected with that bacteria tends to be removed by this. Then we can use the laser and sterilize the root surface of the tooth. Those little bacteria that are living down in there, as soon as we put the laser on there, that kills them too. So now you've got a sterile root surface and you've got clean, healthy gums, and they have a chance to connect again. And we'll actually, in some patients, we see some bone starting to come back. If we take care of the bite on top of that, so the teeth are hitting the right way, we have a chance to beat this disease.
I'm Sean Keller, and thanks for listening.